Good afternoon. I want to welcome everyone to the Appropriations Committee. This is Wednesday, March 31st. The Appropriations Committee is going to have a voting session, relatively short voting session today. I'm the chair, Maggie McIntosh, and I welcome everyone who is watching our proceedings. We're going to begin today with House Bill 581, which is Chairman Davis's bill on labor and employment standards during an emergency. I think you have probably heard it referred to as the Maryland Essential Workers Protection Act. I know I've been contacted about it, and I'm sure others have too. They have done a terrific job in ECM working out, I think, all of the issues, and we're going to have Michelle Lambert walk through the bill with us, but I think we also, do we have Laura Atlas with us? Laura?
Yeah, Laura Addis is here too.
We're going to give Laura Addis a shout out because she's the one who had to work in ECM on all of these amendments and work through with the subcommittee. So we're very, really pleased to have you with us. So at this point, I'll turn it over to Michelle to walk through the amendments, okay?
Okay, House Bill 581 is the Maryland Essential Workers Protection Act. You should have received an updated reprint this morning that just made some technical changes from the reprint you received previously. The amended bill changes the scope of what is considered an emergency to instead be just a catastrophic health emergency. The amended bill also limits the scope of who is an essential worker and makes changes to the safety provisions of the bill. The bill as introduced had a separate right to refuse provision, and in the amendment now just cross-references the existing right to refuse under MOSH law. The bill as amended has additional safety provision, requirements for employers to provide necessary safety equipment, and employer pay for testing if testing is not covered by health benefits or otherwise provided for free. The amended bill also requires employers to provide public health emergency leave in an amount that is up to 14 days for full-time workers and a lesser amount for part-time workers, but this is subject to funding provided by the federal or state government. The enforcement provisions have changed in the bill based on comments from the Department of Labor. There are a number of uncodified provision requirements on the Secretary of Labor and also requirements for the Maryland Department of Health to develop a template health emergency plan for responding to a catastrophic health emergency, reporting requirements for the Maryland Occupational Safety and Health, and the uncodified provisions also clarify that this act applies prospectively. Lastly, before moving the amendment, I just wanted to point out that the fiscal note for the bill does a deep analysis on the cost of essential worker pay, but the chair of ECM's amendments to the bill removed that requirement from the bill. The requirements for personal safety equipment is subject to the availability, and the leave requirements discussed in the fiscal note are also subject to the availability of state and federal funds. And then Laura Addis from ECM is here to answer any specific questions anyone has on the amended bill.
Okay. Are there any questions? Any questions? Delegate Beitzel?
Yeah, thank you, Madam Chair. The bill as initially came out, it applied also, I think, to local government, and it indicates it was a mandate on local governments. Is that provision still in place? And if it is, what kind of a mandate, the impact does it have on local government?
Yes, the committee, ECM, did not change the scope so that it would still apply to the state and local governments as employers. I do not, we don't have an updated fiscal note or letter from DLS about what the cost would be to local governments specifically. I think the primary drivers of the cost would be the safety equipment requirement, potentially the requirement to provide, to pay for testing, but the testing is only required to be paid by the employer if it's not covered under a worker's health insurance or other benefits, or the worker doesn't otherwise have access to a free test. The leave requirement, as my colleague, Ms. Lambert mentioned is specific to employers who have received funds from the state or federal government to provide the leave to their employees. So it's sort of setting up a framework for leave in the event of of funding being provided. But that's primarily what the bill does as amended.
So there's still a mandate on local government that
Yes,
we don't really know the full impact of what that would be.
correct.
All right, thank you.
Delegate Kettleman.
Thank you, Madam Chair, and I apologize for this question. I know I should know the answer, but I believe this is a bill that required employers to pay an extra $3 per hour. Is that still in the bill, if I've got the right bill?
That's been removed by amendment.
Okay, thank you.
You're welcome.
Before we move on, Michelle, does the supplemental provide any money for essential workers? No?
I haven't gotten a confirmation yet. I mean, it's a
Okay,
long supplemental,
okay.
but I'll let you know at 2 p.m.
Okay, good, thank you. All right, Delegate Valentina Smith.
Thank you. Sorry, I was just reading the reprint real quick. So I think it's page 10. It talks about the employers being able to pick safety standards adopted by a federal or state agency. So is it either or? Each employer can pick, some want to go with federal, some want to go with state, but they can make their own decision, or should that be an and?
Are you looking, Delegate, at the new section 31603?
Yeah. So they can pick either federal or
It says
state.
that, oh, go ahead.
No, just go ahead. It comply with applicable safety standards adopted by a federal or state agency.
So that wording is designed to capture any applicable standard.
So
Federal or state standard would, all the applicable standards would need to be, employers wouldn't have a choice. They would need to comply with all applicable standards.
So it might need to be I was just suggesting it might need to be an and then, because they might be able to pick one or the other. I thought it might be it might be saying to employers, you can pick safety standards adopted, you can pick either the federal or the state. You're the drafters. I trust your interpretation. I just was confused on whether they got to pick or not. Thank
If you
you.
put an and there, it could be confusing. So I think what Laura's trying to say is that it doesn't give them the option, but if we said federal and state agency, then it'd have to be the exact same standard.
But they do have to comply. And in order to do this, an employer has to comply with both federal and state.
Yeah,
Yes.
and a number of places in the bill, it requires employers to comply with existing standards. So that's certainly in the intent, and I believe it's clear, but I can circle back with some other DLS colleagues just to confirm that that's how it would be interpreted.
Thank you. I appreciate it. I just want to make sure we understand what the employers are facing. So it's federal and state. Thank you.
Okay, Delegate
You're
Grimm.
I think my question was just answered. So it doesn't matter if one is stricter than the other. One standard is stricter than the other. You have to comply with both.
Well, the way the occupational safety and health law works, the federal OSHA sets the floor, and then the state MOSH can be more stringent. So in this case, the standards, as I understand them, are pretty much on par, state and federal standards. So but the state can be more stringent.
Okay,
And the employers need to comply with the more stringent standard.
okay, Delegate Beitzel, you have another question?
Yeah, if you don't mind, Madam Chair.
I don't.
Since we got the experts here, especially Laura, how is this any different than what the administration has already done through this whole pandemic up to this point? Is this kind of codifying what they've done, or is this making things different than what they've been doing with the way they've handled the pandemic?
The way that I sort of view this bill at a high level as amended by ECM is that it sets up a framework in place for future catastrophic health emergencies. So for one of the provisions requires the Department of Health, Department of Labor, and local health departments to develop a template health emergency preparedness plan. That plan has to provide for a coordinated response for how people can make complaints about workplace safety issues. There was testimony in ECM on a separate bill, House Bill 124, that there has been sort of some confusion among workers as to how to make complaints. In a number of cases, the local departments of health, where Governor Hogan issued an executive order that gave local departments of health additional authority during COVID. And so local departments of health are stepping in some cases, but it's been kind of a patchwork. So the bill sort of puts in one place in the law that in a catastrophic health emergency, when the governor has proclaimed that that is in effect, employers that are deemed essential have to follow some sort of basic requirements like providing safety equipment, paying for testing if it's not otherwise free to the worker or covered by insurance. And then there's a framework there if federal or state funding is made available for the leave to take. The federal Families First Coronavirus Relief Act, the FFCRA, you all, I'm sure, are very familiar, provided for paid leave. So employers received a tax credit for that leave. And so this sort of sets a framework in place, reasons that someone could take leave if funding is made available to employers, at any point in the future.
Yeah, if I may, Madam Chair, just a quick follow-up. I know we had difficulty with the locals and our local health officer following what kind of guidelines was essential and what is essential and what isn't essential. And they were closing down what was considered to be essential businesses. Does this make it more specific and outline more clearly what practices would be used in that case?
So the bill does not specifically provide for additional enforcement authority for any state or local agencies. What it does is that it defines the essential worker is more narrowly defined, and essential employer is more narrowly defined in the reprint, so that an essential worker is someone who performs a duty or work responsibility during an emergency that cannot be done remotely or is required to be done at the work site. And the worker provides services that the employer determines to be essential or critical to its operations. So an individual employer is involved in the process of deciding which workers would benefit. And then as to more generally which employers are covered, that would be the requirements of this subtitle only apply to employers in industries and sectors that either the governor or a federal or state agency identifies as critical to remain in operation during the emergency. Not sure if that answers your question.
Yeah, pretty well. Thank you.
Okay, Delegate Hanson, you have a question?
Thank you, Madam Chair. And I think Council just touched on it as well. I wanted to make sure that I understood the way that the public health emergency leave was activated. And it sounds like it would have to be public funding available for the leave to be activated. And you touched on the Family First coronavirus relief that came out from Congress. Would it also be activated if an employer had any other sort of funding, like any of the money in the Relief Act, or if they had a PPP loan? Is it if they have any public funding available to them that the leave is then activated, or does the funding available to them have to be earmarked specifically for leave?
Actually, Ms. Lambert would probably better be able, she's been explaining to me the mechanism through which this funding would be made available. I believe that it's through a budget amendment.
Yeah, so the bill says that it would have to be federal or state funding for public health emergency leave. So if there is specific federal funding brought in through a budget amendment for that leave, then it would be activated, but not, the bill tried to strike that, the amendments try to strike that balance of finding not something super prescriptive, but it is for the public health emergency leave. It has to be clear, not just receiving state or federal funding in response to an emergency.
Thank you. Thank you, Madam Chair.
We're gonna have to move along a little bit. We are secondary on this bill. Delegate Novotny.
Thank you, Madam Chair. So a question, if the state is in a state of emergency and there are National Guard troops being paid by the state as state employees, does this also apply to them in that status?
Well, it wouldn't, as amended, the bill is not just for any state of emergency. The governor would have to proclaim a catastrophic health emergency as defined under the public safety article. And then the governor or a federal or state agency would have to say that those specific types of workers are critical. I would assume that National Guard would be sort of regardless, but I guess it would depend on the nature of the catastrophic health emergency.
Okay, I appreciate that. And just really quickly, I know you touched on it. What is an essential employee and employer? I'm assuming that there was a long debate in the other committee about that, and maybe give me the 30-second synopsis of how you all came to a conclusion on how to define that better.
The bill as it came in, if you all saw the reprint, listed out a number of different industries and sectors that would be covered, and then there was a catch-all. So it was very it was specific, but it was also very inclusive. The subcommittee, Business Regulations Subcommittee in particular, felt it was more appropriate to, since this is not just for COVID, this is for it's more forward-looking for future catastrophic health emergencies, that the governor or a federal or state agency should be involved in deciding sort of what the scope is and which workers should be covered, which workers are essential in that specific emergency. And then there was also discussion about, well, how will an employer know, which workers can and can't work remotely, who would benefit from the provisions in the bill. And that was why the language was added to say that the second prong of the essential worker definition says that it's someone who provides services that the essential employer determines to be essential or critical to its operations.
Thank you. Thank you, Madam Chair.
Thank you. Delegate Kettleman.
Thank you, Madam Chair. I'm sort of reading through this, and there's one provision that it seems to be set on its own, and that reads that an essential worker can refuse to perform any particular task. And I just wondered what that means in the context of this section 3-1604.
So that's essentially the right to refuse provision. The bill has set up a separate sort of process and qualification standards that a worker would need to follow to be protected from adverse action for refusing to perform a duty in an unsafe work environment. The Business Regulations Subcommittee heard from the Commissioner of Labor and Industry about the existing right to refuse standard, which is under MOSH law. And so that's the cross-reference there. And that applies in all settings, including healthcare settings. The committee and subcommittee heard a lot from healthcare, hospitals and the like, saying that right to refuse would be difficult for them. But the cross-reference here is just referencing an existing standard. So it's actually mostly in COMAR, but there's a specific set of circumstances that a worker has to be able to prove in order to be protected from being fired or sort of retaliated against for refusing to perform a specific job duty. Okay, so in that way, this isn't establishing any sort of a new standard for right to refuse. It's just referencing the existing standard.
Okay, that's
good. Thank you. I'm going to take one last question from Delegate Solomon, who was on the work group, and I thank you for representing the Appropriations Committee on that work group.
Thank you, Madam Chair. It actually wasn't a question. I was just going to answer to Delegate Beitzel's point earlier. One of the other big things that we talked about, and Laura, thank you for your hard work on this too. What I know a lot of us were concerned over, particularly in the university system and some of our state agencies that we all dealt with over the summer, that there were sort of unclear standards of what different workers at different agencies and different schools were being provided. And so this also covers the state employees and kind of creates one uniform standard for that as well beyond the private employer. Thank you, Madam Chair.
Thank you. Thank you very much. All right, do I have a motion on these amendments?
Move the amendments.
Thank you. All right, all in favor of the amendment signify by saying aye.
Aye.
Anyone opposed to the amendments? Okay, on the bill as amended, House Bill 581, we are secondary. All those in favor signify by saying aye.
Aye.
Anyone opposed? Anyone opposed? I see no, oh, I do see, I'm sorry. So I see Beitzel, Kettleman, Metzger, Novotny, Greist, Mangione, McKay. Am I correct? Okay, thank you very much. We're now going to move to House Bill 1003.
Yes, hi, Madam Speaker, that would be me.
That's Delegate Resnick, I'm sorry.
Hi, thank you, everybody. House Bill 1003 is a bill sponsored by Delegate Learman on emergency procurement and budget amendments, notices, and authorizations. We have amendments that conform this bill to the Senate cross-file sponsored by Senator Pinsky. Essentially, what the bill now does is it creates a mechanism for when, if a governor moves forward with executing an emergency procurement, the Legislative Policy Committee has to be informed within 72 hours of the contract or the expenditure of funds. Move the amendments.
Okay, any questions? All right, do we have a second?
Second.
All those in favor signify by saying aye.
Aye.
Anyone opposed to the amendments? On the bill as amended, House Bill 1003. All those in favor signify by saying aye.
Aye.
Anyone opposed, raise your hand, please. Okay, I have Beitzel, Kettleman, Metzger, Novotny, Greist, Mangione, McKay. Is that correct? Okay, thank you. Let's move to Senate Bill 259. Delegate Corman.
Thank you, Madam Chair. Senate Bill 259 was a departmental bill. As it came into the Senate, it would allow the Maryland Department of Transportation to issue up to $750 million in Garvey bonds, which is basically using federal aid to back bonds, so cash up front that they pay back over time with federal aid. This has been used once before in Maryland for the ICC pursuant to legislative authorization. The Senate amended the bill and put in a laundry list of very specific projects. We worked at the subcommittee with the Department of Transportation to refine that approach. As amended, it would authorize MDOT to use the Garvey flexibility they're interested in for three sort of categories. One is the BMP Tunnel Project, which is a $5 billion mega project of really national or at least regional significance that so far there's no sort of funding plan for, as well as State Highway Administration system preservation funding and Maryland Transit Administration state of good repair funding. It doesn't mandate any funding by or any project. It just authorizes this particular financing tool to be used for those three purposes within the $750 million limit that MDOT requested. The bill, and it came out of subcommittee unanimously. I'd move the amendments.
All right, I'll second the amendments. Any discussion on the amendments? All those in favor signify by saying aye.
Aye.
Anyone opposed to the amendments? On the bill as amended, all those in favor signify by saying aye.
Aye.
Anyone opposed? I see no opposition. Okay, we have two bills that have been withdrawn. House Bill 550 and House Bill 1055. So I'll move that the vote on House 550 be the vote on both, going once, going twice, gone. Very good. That concludes our voting session for today. Michelle, any announcements?
The full committee is going to meet at 2 p.m. today for a briefing by DLS on the supplemental budget. I emailed all your offices a copy of the supplemental budget, so you should all have that now in your emails. And if you are a member of the conference committee, if you could keep 3 p.m. open on your schedule, that is the plan right now for conference committee.
Yeah, and you did find some money in the supplemental for the workers and.
Yeah, the supplemental has
Yes.
22.1 million in FY21 for quarantine and response pay and 40 million in FY22 in response pay for state employees that can't adequately social distance at work and state employees who work in COVID quarantine areas. So,
Okay. That is a part of the supplemental that we'll be hearing later today that the governor sent down. Okay, I thank you very much, and I'll see you later this afternoon for walking through what is the largest supplemental I think I have ever seen. Delegate,
Madam Chair, can I ask a
you
quick
have a
question?
question?
Just, sorry, when we're reading the supplemental, getting ready for 2 o'clock, so like on page 2, where it talks about federal funds and then it's like 99.991, what's our cross-reference back to that? Are those budget numbers from budget? I'm just trying to connect it back.
I don't, maybe you and I can talk offline about it and get you answers.
Okay, it's just, it says American Rescue Plan Act, and then there's a whole bunch of numbers with figures, and I'm not sure how to figure out what they are. Thank you.
Okay, thanks.
Thank you. Thank you very much.